Burnout is serious. The pandemic has really taken its toll on nurses. However, nursing as a profession has always been prone to burnout. We are with patients at their most vulnerable times, when they come into the world and when they leave the world and anything in between. Nursing is a tough job. There is an emotional range that nurses have, from complete joy, total elation, to devastation and extreme sadness. Because of that, and when that gets repeated, when nurses are repeatedly exposed to stressors, then that means that they're at risk for burnout.
Often you have caregivers, like nurses, or even people who are not nurses, who prioritize caring for others. And so then they don't leave enough time for self-care, or they think that self-care is selfish. If you help remember, what was your passion, what was your why for that? And how can you promote longevity? You know, you can do this longer, and you can, if you have this vision of helping these many people or having this outcome, it'll be truncated if you don't take care of yourself. You can help them see self-care is not selfish. Self-care is actually philanthropic, because when you give to yourself, it gives you more wherewithal to help other people.
During the pandemic, when there was a high degree of uncertainty, nurses were having to make decisions between meeting the needs of their own families and taking care of their own families, as well as meeting the needs of the organization, their patients. It became really difficult for them and probably added to their feelings of burnout. Burnout is a predictor of turnover. What we know is that burnout has increased, and because burnout affects turnover, we may likely see an increase in turnover. It costs between about $82,000 and $88,000 per nurse turnover. So when a nurse leaves, it could range somewhere above $80,000 to replace them.